If you have flat feet and it's causing you pain, then this video might be for you. I'm Dr. An Nguyen, and today we're gonna talk about flat feet and what we can do about it, whether it's conservative treatment versus surgical. A lot of times people ask, what is flat feet? And people who have flat feet typically have been told at one point in their life when they go to a shoe store or to another doctor that they pronate. And what that means is your heel, if you're looking at it from the back, it actually kicks outwards. And when it kicks outwards, that heel will cause the rest of the foot to collapse. So when that pronation happens, then you have an arch collapsing along with it, and that combination is where you get flat feet. If you were to look at someone's foot, so this is a left foot, and if you were to look at them from behind, what would happen is that heel flattens, right? So that pronates, and when that pronates, you can see that arch flattens out too. And people's feet are flexible. It's not like this model, but it'll be flexible. When it flattens out, then the whole foot, when you look at it, looks pretty much like pancakes, and they'll be completely flat. So when we address flat feet and we treat it, we try to address that issue. We try to get that heel to be more upright, and we try to get the arch to be supported. So we'll typically start conservative, and that's where orthotics and custom inserts come into play. And that helps simulate what we would eventually, if we had to, do in surgery. Technically speaking, whenever you have flat feet and that heel kicks outwards, we say in medical terms that this lateral column, this side of the foot, is shorter. It's kind of truncated on this side. And when we do surgery, what I actually do is I stick a wedge into this side of the heel. And what that does is it kicks it over. When it kicks it over, that's where you get that heel to be more straight upright. And that magically will make that arch form. And then we put another little wedge right here, and that kind of pushes that foot downwards. And that combo together is a really powerful procedure where we can correct your flat feet. The benefit of the surgery, whenever you're undergoing a flat foot reconstruction, the main thing that we always look for is we're trying to realign those joints. So when I'm doing this surgery in the OR and I put that wedge in, I'm constantly adjusting, I'm constantly looking at where those joints line up after I put that in there. And once we find that perfect size, all your joints should be really in a great position, and that way they're moving and gliding nicely, and they're not in a bad position that could eventually cause arthritis down the line. The other benefit is it really takes the strain off of certain ligaments in your feet, also certain muscles and tendons that get worn out just from being overused, being overworked, having to work overtime compared to everyone else. And so those are the huge benefits that come with going through the surgery. Any surgery can always come with negatives. There's risks, and nowadays with advanced medicine, those risks are minimized. However, there's definitely still risks, and so obviously the risks of just anesthesia in itself can be something to always consider. Anesthesia at this point is very, very safe, but there's always that tiny risk that can cause issues either during the procedure or after the procedure. The other risk that comes with the surgery is just it doesn't work. You know, we do surgery and we're very confident in what we do, but 95-99% of the time you do great. But every once in a while you go through the surgery and the same exact thing still continues, and that's always a possibility. And so that's always something to consider. No matter what doctor you go to, they should always say that there's a small chance that your issue might not be resolved from surgery. The other thing is scarring and stiffness, which is something that happens, and that's something that can occur and last for months or even a year or two. And so that's another issue. One of the biggest downsides I think that patients don't like to hear is they're down for 6 to 8 weeks, so almost 2 months, where they have to really baby the foot. They might even have to be off of the foot completely for at least 4 to 6 weeks after the surgery. And so that recovery period can be daunting too. And that's where, if you're considering surgery, pain and limitation to your daily activities is one of those things that we say is the big key factor in why you would even get the surgery to begin with. If you don't, then doing those other conservative measures would probably be what's best for you. So if you've had flat feet, or if flat feet runs in your family and you notice your dad or your grandfather has a lot of pain because they've lived with flat feet their whole life, then you're probably someone that should come see a podiatrist, because we can address it. We can look at what your options are, whether it's getting fitted for orthotics or surgery. And even though surgery comes with those risks and those possible downsides, the benefits certainly outweigh the risk that comes with the surgery. And so it's something that if it causes you every single day where you're stuck with pain or you're limited and you have to alter your daily activities, then then it's something that you should definitely get checked out by your local podiatrist. Or if you happen to be in the Tampa Bay area, then we're here and we can help you out.